Assalamu alaikum, everyone. We apologize for the late start. My name is Jamal Ahmed. I'm currently in ST4 working in South Wales at the Grange University Hospital. Today's talk will be why choose gastroenterology and how to seek your
My name is
Jamal Ahmed. I'm
gastroenterology
currently in
training
ST4 working in South Wales at the Grange. So just a bit of a content as to what we'll be talking about today. Essentially, we'll touch upon why gastroenterology. We'll talk about a bit of insight into high specialty training as well. I'll discuss an overview of the personal specification required to obtain a number. We'll also discuss briefly the application process and the interview section to the application, and then we'll provide a summary afterwards, and we can discuss any questions you may have. Okay, so why gastroenterology? So if I could summarize in a couple of words why gastroenterology is a specialty to choose, essentially it's a very diverse and exciting specialty. It provides the clinician or the budding physician with opportunity to look after acutely unwell patients who present to our emergency departments unwell, as well as managing chronically unwell patients both in the outpatient setting and on the wards. There is a drive, particularly in healthcare over the last couple of decades, for disease prevention. And I think gastroenterology is the pinnacle of that, particularly through bowel cancer screening and involvement in alcohol harm reduction programs, particularly for liver disease patients. There's an opportunity in these specialties to provide this physician to perform advanced technical procedures, and these can be challenging but also very rewarding at the same time. And one can also become specialized in the area of gastroenterology that they find particularly enjoyable. So that adds another dimension to this specialty. Over the last few years, there's been rapidly progressive technology that's pushed the specialty forward as well. And I think particularly over the last few years as well, ongoing technical advancements, developments means that you're constantly developing new knowledge and acquiring new skills to aid your practice. Now, as with most medical specialities, they provide a holistic care approach, it's part of the day-to-day work. But I think gastroenterology is a great example of this. As working as gastroenterologist, you'll be constantly interacting with many healthcare professionals and allies as part of the MDT. And this diagram here just illustrates some of the members that you'll be working alongside. So particularly surgeons when it comes to inflammatory bowel disease, histopathologists also provide a great help, particularly for diagnostic purposes. Of course, nurse endoscopists are pinnacle as well and help with waiting lists for endoscopy. Dietitians, they form an integral part of the management of liver disease patients. And of course, oncologists and radiologists, when it comes to the cancer aspect of the specialty, provide a great support network. Okay, so training in a high specialty gastroenterology person, what does this entail? So we touched on the previous slide, as the holistic aspect of the specialty. There'll be constant interaction with other healthcare professionals. And it's important to recognize that these will not just be medical, but also non-medical professionals. There's opportunity to subspecialize, so working in advanced endoscopy and nutrition centers as part of an out-of-program initiative. There is also the potential for fellowships, particularly in advanced hepatology and endoscopy, and these are widely available in a number of centres across the United Kingdom. And of course, there's a division of practice, particularly with subspecialties. And the main two branches are hepatology and luminal gastroenterologists, but also there's a role for academia in this career as well. So what do the career prospects look like after you finish training in gastroenterology? Well, there is a great drive for consultant jobs, particularly with the increasing burden of liver disease. And in fact, liver disease is now overtaking ischemic heart disease as the leading cause of mortality in younger age groups. And overall, I would say there's good opportunities and prospects at the end of training. For those working less than full time, there's option for sessional elements to the specialty, and this allows a degree of flexibility. And again, there's a role to participate in wider national screening programs such as the bowel cancer screening as well, which is quite exciting. So what would I say are the main characteristics of a gastroenterology trainee? Well, I think you've got to be interested in rapidly evolving speciality, okay, and you're particularly excited with change. You've got to be hardworking and motivated, and I think that goes without saying to help get through such a rigorous training program. I think gastroenterology provides the option for one to have a varied specialty. So if you enjoy working in a a varied have a varied working week, then this is a great choice for you. And I think what really drove me to the career was the hands-on aspect to the work. And I think if you enjoy a hands-on element to your work to help complement your clinical work, then this is definitely a specialty for you, particularly with endoscopy and advanced endoscopy. It's a very exciting avenue to go down. Again, we talked about it earlier, but I think being a good team player and working well with other members of your team as part of MDT is paramount to being a good gastroenterology trainee. And again, as part of the variety to your work, managing acutely unwell patients, but those with chronic disease is also an important facet, I think, for the specialty. So we touched upon it briefly earlier about the subspecialization in gastroenterology. Now, this slide essentially outlines things in a bit more detail. So at present, hepatology is the only recognized post-CCT post-CCT subspecialty that one can achieve. And training now is undertaken in the penultimate year. So one will spend the last 2 years of training specializing in advanced liver disease. And there's opportunities as well to specialize post-CCT in a wide range of subspecialties, which are outlined by the diagram here. So particularly for those interested in luminal medicine, there's inflammatory bowel disease, there's hepatopancreatobiliary disease as well, and that works well alongside advanced ERCP. As you can see, advanced endoscopy is another section as well, and there's options to undertake to become competent in advanced polypectomy, for example, endomucosal resection, as well as EUS as well. Of course, transplant plays a massive role in hepatology, and that's another well-recognized subspecialty. And of course, clinical nutrition as well is another branch that one can go down in. So what would one expect when undertaking high specialty training in gastroenterology? Well, completion of CCT allows one to become dual accredited both in gastroenterology and general internal medicine. With the new 4-year training program, this will be the minimum number of years that one will take to complete the training, and that goes from ST4 to ST7. What has changed in the new curriculum is there is a critical progression point at ST5, where one decides to go down the luminal route or the hepatology route. And I think, as I'm sure you're aware, even with foundation years in IMT, the curriculum continues, and I think this is even more rigorous, particularly ST training, to keep on top of your portfolio and get your endoscopy signed off. So this is, I guess, one of the challenges, particularly in training. The exit exam is also required during training, and this is usually set at the ST5 level. Now, the next 2 points highly depend on the deanery you work in, but there will be a rotation between tertiary centres particularly liver transplant units and nutritional centers, as well as district general hospitals. And there's an option as well to participate in a specialist out of bleeders rota as well. Again, this depends on the deanery that you work in. We touched upon it earlier, but there's also opportunities as well to spend out of program training in an area that you like, such as nutrition, hepatology, or advanced endoscopy. One of the major challenges of the new curriculum, new 4-year program, is the amount of time spent in GIM, and this equates to about 25% of training. But of course, it's something that needs to be undertaken, and will provide you with dual accreditation once you CCT. And another important thing to remember is, given the fact this is now a 4-year training program, it's likely that trainees will require a post-CCT fellowship in one of the areas that I outlined before, to fully become competent, essentially. And that's not something to be looked down upon. It's something I think that will become normal in the future. So a bit of an overview then about the personal specification required to enter ST4 level. Now, ideally, you should have had a sufficient experience working in medical specialities. Okay, this is not including the years taken during F1 and F2 by the time you start. Programs that you undertake prior to starting ST4 should comprise of 4 to 6 medical specialities, which involve direct acute medical take, and this is important, as we'll touch upon later. Traditionally, at present, the traditional route is via the IMT level, or the IMT route, but there's also option of undertaking the ACCS internal medicine route to enter ST4 level at the moment. Now, it is important to remember that it is not mandatory to have worked in gastroenterology before you enter ST4 level, but of course it is advantageous if you have some prior experience in rotations in gastroenterology. What I would advise for those who don't get the opportunity to work in gastroenterology departments is really, and obviously if you're interested in starting gastroenterology training, is to seek opportunities in your local hospitals to get involved in taster weeks, for example, research projects and audits. And this, as we'll touch upon later, will be very helpful. Now, the diagram here just outlines the main routes to enter ST4 level. So as the IMT route, there is also the standalone IMT3 program, and this is for the people who've undertaken the old core medical training route. The UK ACCS internal medicine route, as we touched upon, and there's also the UK broad-based training program as well. I think this diagram essentially illustrates quite nicely the road from post-graduation from medical school right up until CCT. As you can see, there's 2 years of foundation training, and then there's selection for IMT. This is obviously now a 3-year training program where one will have to gain the MRCP diploma at this point. And then there's further competitive selection for gastroenterology training, which is 4 years after that. Okay, so we'll touch a bit more now about the overview of the personal specification. And this section will focus on the clinical experience and skills that will be essential or either desirable to obtain a number. So as you can see from the table here, we touched upon it earlier. One of the essential criteria will be to have quite a broad range of experience in acute medical specialities, okay, particularly those where you're involved in the medical take. You need to have developed awareness of managing an acute medical patients, emergencies, inpatient and outpatients, okay? And also be able to demonstrate that you've got the appropriate knowledge base. This will come through, obviously, the MRCP exams, as well as work-based assessments that form your portfolio. And again, the ability to prioritize clinical need as well. So these are all essential criteria that one will require. And there is also desirable criteria as well on the other side here. I won't run through each one individually. I'm sure you'll be able to see them. But essentially, all these will be evaluated either on your application form when you come to apply, at the interview, and on references as well from your consultants. So this is the second slide, which outlines some of the personal skills required. And again, the table illustrates most of these here. The essential criteria, again, is to be able to demonstrate clarity in spoken and written communication. Again, these will form part of your work-based assessments, MSFs, and multiple consultant reports that form part of your portfolio. You need to be able to build rapport, listen, and negotiate. And again, this will be examined at the interview stage. You need to be able to show leadership, make decisions, be someone who's organized and motivated to work with other team members. And you need to show self-discipline, commitment. Again, these are all demonstrated in your multi-system feedbacks and multiple consultant reports throughout IMT level to be able to get through the program. And of course, there's some some desirable criteria here which I touched upon. I touched upon voluntary work, which is important, and obviously showing leadership in and outside of medicine. And I'll touch upon some tips on how to obtain some of these criteria later on. And again, all these will be evaluated at the application form, on the application form, and the interview, and your job references. Now, commitment to speciality is one of the new aspects of the application program, and you need to show some element of initiative and drive and enthusiasm to show the interviews that you're interested in this in obtaining a gastroenterology number and working as a registrar for them. And you need to show and demonstrate interest of the speciality and some level of commitment as well. And again, this will be all evaluated again in the application form and your references, and of course at the interview. So what about the academic skills required as part of the personal specification? So research, audit, and quality improvement projects are essential criteria. And you need to have developed an understanding of these and have been able to show that you've undertaken some of these during your foundation training, particularly as well in IMT. This is an essential criteria. And touching upon some of the other points, you need to show involvement either in QIPs or formal research projects using the correct QI methodology, which focuses on improving patient care and outcomes. And I think one of the desirable criteria would be demonstrating understanding of clinical governance, and this can come up at the interview stage. Now, teaching forms an integral part of the application, and you need to have shown an awareness of importance of teaching, but also carried out teaching and have teaching experience. And as you can see, I've touched upon training and teaching, which we can discuss briefly afterwards. But you need to have shown, particularly at the application process, that you have been involved in teaching medical students or postgraduate clinicians or other healthcare professionals, and participating in a teaching course. And we'll touch upon that when we discuss the application process in a bit more detail. Again, this, like the other slide, this will all be evaluated and assessed on the application form and the interview and your references again. Right, so this is quite an important slide just for you all to be aware of. Okay, so this is the physician specialty training scoring matrix, which has changed this year. So it's very important that you are aware of this. The overview of the scoring matrix essentially is, to maximize as many points as you can in all the domains as possible. Okay. Now, I can't emphasize the importance of being strategic with your time. We're all very busy, with our personal life, with our, on calls during IMT. It's very difficult to fit everything in. So you need to be very strategic with your time and time efficient. And as I mentioned earlier, this is now changed for 2023. So it's important to become familiar with this. Now, what would my advice be to tackle, this and to help score as highly as you can? So you need to maximize points in teaching. This is an easy section that you can do. You can get involved with your local hospital trust, and speak to one of the consultants, where you can provide teaching either for medical students. This can involve bedside teaching. This, however, won't score as high as organizing a teaching program, which is something that would, which is more impressive essentially, and that will involve good organizational skills, and it will show leadership. So one thing I would advise is, speaking to your local consultant, seeing whether you can recruit teachers yourselves, whether that be consultants or registrars, over a period of a few weeks or months, to teach medical students or even foundation trainees, and you show that you've actually led this program, led this teaching program, okay? And very importantly, that you've obtained feedback forms for the work that you've done. Now, quality improvement project is another easy section to score highly in, and you certainly need to have done one by the time you apply. What I would advise is to perform one in gastroenterology specific. That way you will score points for undertaking QIP, but you also show commitment to specialty. So you essentially hit two birds with one stone here. So that's one way to be strategic, essentially. So do one related to gastroenterology, and these can be obtained or through your local gastroenterology department. Now, due to COVID, MRCP didn't used to be counted in the scoring. It has now been reintroduced, so be mindful of this. And obviously, I would advise you to clear the MRCP as soon as you can. And this will be a big weight, particularly when it comes to scoring. Performing oral presentations at regional national meetings can be a bit more challenging, but certainly achievable. I'd advise you again to speak to consultants or registrars about interesting case reports that you can either make an abstract out of, and these can be presented at regional meetings, and these weigh quite heavy when it comes to points. Now, the other section, which has also been scored in previous, has always been there, is the postgrad diplomas. Now, I personally did one myself prior to obtaining my number, and I performed one, a PG dip at the University of South Wales. This was a year-long program, okay, that essentially ran through, it was PG dip in gastroenterology, and it was all online, so you didn't have to be there in person. But one thing to be mindful, this can be quite costly. So again, you need to choose your battles really and decide whether it's right for you or not. But certainly it will score you some points and will also tick the box for commitment. Now, leadership is an area that people struggle with, okay? But again, is part of the scoring matrix this year again. One thing that I personally did was I emailed my consultant during IMT1, and I volunteered myself for the Royal College position Associate College Tutor, which is ACT for short. And this scored me points as a regional, as a national, actually, a national leadership. Essentially, what the role actually entails is you act as a network or bridge between the college tutor at your deanery and the trainees, and you act as a voice or advocate to highlight any training program, any training problems that trainees are facing, and relaying back this to your college tutor. You also are invited to meetings four times a year with the Royal College, where you can feed this all back to the Royal College essentially. So again, not everyone will be able to do that, but I think that's just something to be mindful of. Other ways of developing, showing leadership would be to being either the mess president and things like that, but these will score you slightly less, of course, as they'll only be local, showing you local leadership. Now, it was introduced last year, but the commitment to speciality is now part of the scoring system, and it's worth 20 points. It's very worth being aware of this and being able to score as highly as you can in this section. And one ways to do this essentially are arranging taster courses, okay, particularly with the BSG, as they're on twice a year. So these are all things that will score you points, or even undertaking endoscopy courses as well at a basic level. One thing I can't reiterate highly enough is please be clear and organized when it comes to the application form. Don't be rushing at the end, the last week before you apply and trying to get everything together. Get all your evidence beforehand from your consultants. Make sure it's clear um, for the examiners to read so that you can be scored properly. I'm happy to discuss with people after the session if they have any questions regarding this. Okay, so this is just a quick slide about application numbers and competition ratios, which people might be interested in. As you can see here, obtaining a gastroenterology number is competitive compared to other medical specialities. And last year, there was 3.4 applicants for one place. As you can see in 2021, there was no recruitment apart from Wales, who were recruiting ST3 level due to COVID. But overall, there is significant amounts of applicants for one spot. So this table really outlines the competitive nature of obtaining a number. Okay, so I'll briefly discuss the interview process. So the interview process has changed now again since last year. So again, really make yourself be mindful of this when it comes to preparing. The interview now is split across 2 separate stations. Each station is split into 2 parts. Each station, so station 1 and station 2, each is 15 minutes long with 3 minutes preparation or reading time beforehand, which makes the presentation, which makes the interview 36 minutes in total. Okay, so there is 4 sections. There's the clinical scenario section, there's the presentation, the suitability and commitments section, and the medical registrar suitability section. And this last one came in only last year. So again, this is something to be mindful of. So a bit about station 1 and the first section, the question 1, which is the clinical scenario. So as I mentioned earlier, you will be given a clinical scenario beforehand to review. And the questions will be based on the clinical scenario, and you'll be marked accordingly. There will be 2 consultant interviewers on the panel asking you questions. And essentially, with this, you'll be provided with a scenario, and I'll touch upon in the next slide which ones typically come up. The way to split it essentially is with those 4 steps that I've put at the bottom slide there. So you need to obtain a history, okay, an examination of what you would be looking for, what relevant investigations you would request, and treatment. And this would all be stuff that you'll be feeding back to the examiner, okay? And they may want to ask you questions about each domain separately. You need to be really thinking about how you will communicate with the patient with regards to the investigations you'll be requesting and treatment options, but also be aware that you can also be communicating with, family relatives, colleagues as well. And there will be a score for your communication as well, not just the knowledge that you have. So this slide essentially outlines the main scenarios that come forward. So decompensated liver disease is probably the most common one that that comes up. So you need to know the basal liver bundle by heart, essentially. And this is easily accessible, on the internet. I got acute liver failure in mine, so you need to know really the ins and outs and be meticulous in managing patients with acute liver failure. C. diff infection is one that comes up. Candidates have often got acute biliary diarrhea, whether this is sort of IBD, for example. Biliary sepsis has come up previously. Dyspepsia, and it's important to know guidelines, and particularly when you would refer for urgent OGDs, for example, when it comes to this. And dysphagia has also come up, as well as HPP malignancy. Okay, so you see the last one would be an example of where communication with family relatives would be really important here, okay, and what next steps you would take as well when referring on to MDTs, for example. Okay, so The second part of station one is the presentation section. Now, this really, I feel, is an opportunity to score very highly in. The ball is really in your court when it comes to this. So essentially, you need to give a presentation on one of the following topics for no more than 4 minutes. So the two options that they present you with, or one that you choose, is an interesting case that you have been involved in, or an interesting recent development in gastroenterology. Personally, I would strongly advise that you pick the former option, the interesting case. It's very easy to speak about something that you've been directly involved in, okay? And as well, if you're speaking about a research topic in gastroenterology or a recent development, you really need to know your facts very well, because you could be sitting in front of the professor in that, field, who could really grill you. So I think the safest option, and one where you'd score high points, is the interesting case. That's the one that I presented as well. And I'm happy to discuss this with people afterwards if they need any questions. So you need to bear in mind the following. Really choose a relevant topic that you want to talk about, and speak with clarity, okay, and come across clearly and confidently. Now, you really need to know your talk almost off by heart, so it's second nature to you. You need to practice this in the mirror or with family members beforehand, so that it comes out, naturally and effectively. It's important to remember that no visual aids or prompts will be allowed in this station, and there will be a post-presentation discussion led by the interviewers after. And this will be about 4 minutes, okay? And they'll ask you questions really about why you chose this topic, what learning points you gain from it, how you can reflect for this topic for next time. Okay, so the station two, which is the first question, will be your suitability commitment. Again, this is an area that you can score very highly in, okay? So this station focuses on your commitment and suitability to training, and gives you really the opportunity to expand on what you've already declared in your application form. I've highlighted here some of the questions that one will what you will likely be asked in the interview when it comes to suitability. Okay, so these are all questions that you can predict essentially what and how to, and you should be able to prepare for these quite well. But essentially, why gastroenterology? Where will the specialty be in 5 years' time? What advancements are you aware of? They'll ask you a few personal questions, things like, where do you see yourself in 5 years' time? I think the final 2 points there are quite interesting. So what are the challenges to gastroenterology in the next few years? This is really important. Again, shows your understanding and commitment to the specialty, and the challenges to training as well. And then they will also ask you specific questions related to your application form, and these will be centered around tell me any presentations you've given, to open up a bit more about what role you had, your teaching, and your QIP as well. So that's a brief overview of really what this station is about. Okay, so the second part of station two was newly introduced last year, which is the medical registrar suitability station. Okay, and most of you, by the time you apply for gastro, you'll be working at IMT3 level, and you've had chance to work as a medical registrar, or at least stepping up as a medical registrar. So this question is really centered around how you would manage the acute unselected take, how would you manage a multidisciplinary team, particularly with discharge planning, and draws upon your experiences. So questions really are surrounded by, tell me a time you had to prioritize 2 unwell patients, how you manage situations like this, tell me how you managed situations out of hours when your consultant wasn't there, for example. Okay, and things like that. And again, I'm happy to discuss a bit more about this afterwards. So in summary, I'm sure you realize it is a competitive specialty, and I think obtaining a number is getting even more competitive now. Okay, you need to play the game well and be effective and manage your time well, essentially. Okay, as I've explained earlier, of course, you need to demonstrate excellence in your career to date. you need to have some form of exposure to specialty, although this is not mandatory. Okay. But again, demonstrating commitment to specialty is now advantageous, as this forms a great part of the scoring system pre-interview. Okay. Now, be practical. Speak to your registrars and consultants at your own health board to gain greater insight into what the specialty involves. You can ask to undertake a taster week in gastroenterology as well. And I would advise attending BSG taster courses. These run once or twice a year, to speak to people who are also in gastroenterology as well, to gain greater insights. So I've put up here just some resources that you can so you're aware of. You want to develop your interest or widen your knowledge in gastroenterology, and I've highlighted some of these here at the bottom. Okay. And these will just give you more insight into recent developments of the specialty and stuff like that. And the BSG have actually recently put up very good webinars and stuff, if people are interested to get more information. Okay, thank you very much, everyone. I welcome any questions. Assalamu alaikum.